Hi. So I can get invitations to go live. This is interesting. Hi, Stacey Lee. How are we today? How are we this Monday? What's up? Hi, Sydney. Monday, April 19th. Thank you. These are those blue white blocker glasses because I should have been wearing them a year ago, but a year into this pandemic and doing everything on the computer and online has really not done well for my eyeballs. I'm okay. It's Monday, just I'm really hungry. And I'm really stoked about this grilled cheese sandwich I just made. What'd y'all do this weekend? Because I did nothing. I have nothing fun to talk about. I shouldn't say that. I have fun things to talk about. I just didn't do anything fun over the weekend. I'm so glad you're here too. I know, summertime it feels like schedules are more relaxed. I know my schedule has more freedom in it during the summertime too. Grilled cheese is the best. Hi. You went to Grand Rapids and saw your brother and went out for breakfast. Good for you. That's fun. We stayed here and did nothing all weekend. It's been a long time since I've done that. You bought yourself some shoes. Good for you. And happy birthday. Because you said you bought it with birthday money, so. Doing nothing is the best sometimes. It is. Sometimes, if you, it can get boring, right? And it can feel lonely, but it was needed and nice and appreciated this weekend or past weekend, whatever. So it was really nice. You had to work all weekend still? Fritos? Yeah, working on the weekends is a thing. So I've had to do that before. It is what it is, right? April 10th was your birthday. Well, happy birthday. And congrats on leveling up. Hi, Paigey P. Oh, I love you. Thank you. Glad you're here. Get back to this sandwich because I'm so hungry this morning. So this morning, we had to wake up early. We wake up early because when you're old, you wake up early, but earlier than normal, and drive my mom to the airport, which is like an hour away. But just up early, running out the door. It's not a usual Monday for me. You were home. You had to wait long at your psychiatrist. I hear that happening a lot. I know psychiatrists are so busy. A lot of mental health professionals are so busy. I know we're busy at my practice too. I'm okay, Miranda. I'm tired. My Monday started off early, and then so I live in Texas, and then I live, I don't know, like an hour north of Dallas ish. And we had to go to the Dallas airport early this morning to drop a family member off. I have a new nephew, very, 2 weeks old. So my mom was flying to see the baby. So we had to take her to the hospital, or to the airport, not the hospital. Hi, Melanie. They're my blue blocker glasses because the computer for a year has really not helped my eyeballs. You had to wait 2 hours to sign a letter. Oh, 2 hours. I'm sorry. And could they not have done that electronically? I'm just saying. I don't know. So, Angelina, why is it so hard to ask for help? There's a million reasons why it's so hard to ask for help. But it's okay. If you want like a first step, go to recovery-academy.com and kind of just check out the resources there. Of course, there's paid stuff that would help you in that. I have a course, Sick Enough, where I talk about how to ask for help and when to ask for help and how do you know if you need to ask for help. I have that course on there. Also, there's a lot of free stuff on there that I do think would be really helpful for you to kind of just get into this, like, how do you start, like, giving yourself permission to, like, take care of yourself and do recovery. Ugh, that's so frustrating about your doctor. You have grilled cheese too? Yay! Cheers to grilled cheese. I do find these glasses very helpful. Well, I do. Because, Melanie, here's what was happening. I have this constant, persistent eye twitch. And it's less. Like, it's significantly less when I'm wearing these glasses. So I would say, yes, they are helpful. So everybody should have a pair right now. You finally got help because of my videos and you're going to treatment. Congratulations. I'm so proud of you. That is so amazing. And I'm so honored that we've connected and that you found this and I found you, and so glad you're here. And Melanie, they have like so many fun ones. I was talking about, so I'm leveling up in a couple of weeks. It'll be my birthday and it's like a big one. And I don't feel old. It's fine, whatever. But like truly, the older you get, your body kind of gets to this place where it's like, nah, bitch, you're old. You know what I mean? Like things happen and eyeballs are really old. And I have not been able to see since I was like in elementary school. Like elementary school, I was wearing glasses that were really thick. So I'm afraid, and now I wear contacts. I'm afraid that, and there's nothing wrong with wearing glasses. The problem is I don't like juggling all the glasses, like sunglasses, and because then I need readers and then I need these. Like, it's hard to just have I just want my eyeballs to work. That's all. And I know I'm complaining and I know this is privileged but really to juggle all the glasses and all the things, it's, cause I forget glasses and then you break them and it's just a lot. Oh, wow. Some good questions here. So when would I say that inpatient treatment is needed? Melanie has a great answer. while I take a bite and chew. Real quickly, let's go through levels of care, okay? Inpatient is the highest level of care, and it's very restrictive. Don't let that word freak you out. What that just means is it's a hospital type setting. You have round the clock nursing, medical care. They're doing a lot of med adjustments usually. Depending on what this is, sometimes people need to go inpatient for an eating disorder because of medical issues. And so that would be a reason to go to inpatient. Suicidality is a reason to go to inpatient. If you're not able to like eat on your own, without any like family support and in like outpatient treatment support, then sometimes, inpatient is needed. You really need like a lot of just people there at all moments, seconds to really monitor and manage things. Then, now it doesn't always step down in this way, but here's kind of the if we had a beautifully perfect mental health system, right? You would go inpatient for, I don't know, a few days ish, couple weeks ish, and then you can go to residential. Residential, you stay there, you sleep there, you like are asked to stay at this place 24/7, but it's less, there's still doctors, there's staff, it's not independent living, but it's more right like daily life. So you're eating all of your meals there. Again, you're sleeping there. You're doing a lot of group therapy. You're doing individual counseling, of course, medication. Partial, same thing, but at partial hospitalization, you go home or you come home or you sleep in your bed overnight. Some places you can stay, like if it's far away from your home, right? And you can't easily commute from home to your program. Sometimes there are some places that have the ability to house you, but you won't necessarily sleep at the program. You go sleep at your own place. You have your own unstructured hours. It's your life. You do whatever, but you're in programming, a few hours a day, most days of the week. And then there is, intensive outpatient, which is outpatient. You're in your life. You can sometimes work and sometimes go to school depending on the program. But again, you're in group therapy, a few hours a day, 3 to 4 days a week. And then outpatient is weekly, but outpatient can also be a couple times a week too. And so it kind of is where you're at then, right? Partial hospitalization is more hours than intensive outpatient, right? It's kind of just like so residential is like programming all day, every day. Partial is programming most days, every day. Intensive outpatient is programming a few hours, a few days a week. And then outpatient is, like you're living your life, you're doing your thing, and then you have a therapist that you check in with and do therapy with once or twice a week. So the next question I was asked similarly to that was, how do you tell your therapist? So, you could say, I think I have an eating disorder. I think I have an eating problem. Can you help me? Sometimes I'm not going to get on my rant about professionals treating eating disorders today. I don't have time for it. I don't have the energy for it. If they're not an eating disorder like specialist, maybe you go to like the National Eating Disorder Association's website. They have a screening tool there. And you take that screening tool and you take those results back to your therapist and you say, I found this thing and this is what it says. Can you help me with this? Or if not, who would you suggest that I go talk to? about this. Oh, you used the Recovery Academy over the summer, doing better and back at work. That's so amazing. Congratulations. I'm proud of you. Like, thank you. This is great. And I'm glad you're here having lunch with us right now. Or a snack. I know it's not maybe like some people are all over the world right now, literally, which is way cool. So it's not like it could be overnight or early morning. So we're just here hanging out, eating meals together. And that's Melanie. It's so hard to say. Melanie is over on Instagram chatting too. It's really hard to say. Like, I hate putting time frames on treatment, even at those levels of care. So I used to work for the insurance company, and I was the eating disorder, like, I don't know, subject matter expert is what they called me. And that is a stigma and a barrier to treatment and proper treatment. So I want to say that first. And then you're right, Melanie, there is this idea that your eating disorder tells you you're not sick enough, because eating disorders like essentially destroy your self-worth. You feel unworthy, you feel powerless, you feel helpless. And so, okay, let's work on helping you find ways in your life to feel worthy and to feel valuable. Because your eating disorder is telling you that it's like your weight in your body, that's where you're going to find those things. Well, let's find other things, because it's not the only way that we find our worth and our value. And I think the more that we focus on finding worth and value in those other things, the less important the body thing becomes. And a lot of other things. I really oversimplified the process of treatment. But if y'all want to know more about how you treat eating disorders, or how I treat eating disorders in a way that will help you, recovery-academy.com. I teach you everything I know about eating disorder recovery. Inpatient, totally medical treatment. That's it. Not a lot of psychiatric mental health treatment goes on. It's, are you medically safe? Are you psychiatrically safe, right? Meaning we're not having acute psychotic symptoms, and we're not suicidal, acutely suicidal. You dig the new glasses. They're those blue blocker glasses, but I was saying I level up in a few weeks in age, and I don't think I'm gonna be able to wear my contacts for much longer. My eyes just aren't as good as they used to be. They're old. Residential is where you're gonna get so much group therapy. Like, you're in treatment every day, all day. Not 24/7. Like, you do fun stuff and you get some freedom, and you get, so I worked at Timberline Knolls, and that program, all the programs that I've visited are beautiful, have beautiful campuses, and you get to do a lot of fun, cool stuff. You do. So it's not like 24/7 in therapy, but it is, residential is where you're gonna get a lot of therapy to help you with an eating disorder. Thoughts on virtual PHP? It's been really helpful for a lot of clients. I know pandemic, a lot of programs had to shift to partial. I've had clients that were in some of these programs before the pandemic, and then of course during the pandemic. So I'm biased towards in-person because I am a therapist who does in-person work, and so I know what like it feels like. I'm making this terrible face. I don't mean it to be like that. Virtual has allowed so many people to get access to care and get help and treatment, and it's great. It's great. Also, in person can feel really good too. So, partial is great online. It's also great in person. I think you take the option that works for you and that's available to you, because it can save your life to go to treatment. For real, 100. We're just eating lunch, hanging out. Can y'all believe that it's already April 19th? I say this every year. Hold on. So where I live, spring break is usually like the second or third week of March. So the beginning of the year, January 1st, until spring break is like eternity. It is the longest year ever. Spring break until December 31st goes by so quick, so fast. It'll be the end of the year over before we know it. You're struggling a lot with your body. I want to invite you to check out recovery-academy.com. Lots of free stuff there, but also a lot of very affordable, very doable recovery resources just on that. I think actually there's a body image bundle where I put together all my courses on body image, like managing it and accepting it and loving it. I had to use the word love, but you know what I mean, right? All this like help you with your body image, that's there. You only have 2 more weeks of school. I know, it's crazy. It's so, I hope we get a great summer, a better summer than last year, I hope. I always look forward to summer though, every year. It could be, well, 2020. I was very much looking forward to summer. I love summer. My newest course in the Recovery Academy is a bad body image day survival kit. So like a whole bunch of like tools and journal prompts and activities and things for you on a bad body image day. My dog's here begging for food. Okay, so maybe recovery feels hard, right? Like the thought of starting it, but what if things could be better, right? Like ask yourself, okay, maybe letting go of the eating disorder, it still feels scary. Okay, go get help to just feel better. Go get help to like be more in your life. Go get help to be more mindful. Go get help to like manage stress and manage anxiety. That's a good place to start. And Melanie's right. Not wanting to recover or feeling you're not sick enough, right? Those are all eating disorder like symptoms. So those are lies. So when you're like, I don't deserve help or I can't get help, that's all bullshit. Like, but here's the thing. I can sit here and say that to you. You don't believe that. And there's a lot of reasons why you don't believe that. And so therapy, recovery is unfucking those messages, right? It's helping you realize you are worthy. Like, you're worthy of being happy. You're worthy of feeling good. Period. And I think you all want to feel better. You want to recover, but then the anxiety and this eating disorder, because it puts lies and bullshit in your head, it feels like you can't. So I think it's just realizing, again, that like you deserve, okay, so like Maslow's hierarchy of needs, right, is this triangle. Like at the very bottom of that is food and like shelter. Like are we just feeling safe and secure? And when you do, then you can like have someone. Sorry, I got a message and it distracted me over here. Let me get my thought back. You deserve to want to vibe higher, right? To be in your life and live and have happy moments. It doesn't mean that happiness sticks and stays with us all day forever. It just means that like we deserve to want to live the most peaceful life that we can find to live. So you're allowed to want to go do that. You're allowed to want to like not feel so uncomfortable. So if you can get 1% more comfortable, that's amazing. Good for you. That's enough. That's great. You can want to be as feel good as you want. That's what's great about it. The Recovery Academy resources really helped you. Yay! You were obsessing over every meal, and now you're excited about dinner. See, it does get easier, and it is possible, and it's like when we're not spending so much time thinking about food, we get to do a lot of cool stuff. You should be proud of yourself. Congratulations. Completed second meal today. Good job. And I'm glad you're here. Yay. Make sure I didn't miss anything. Whoa, Annalie on Instagram, you're so right. It's not that like the individual doesn't want to recover because you want to feel better, right? It's that there's this like sick part of your brain, and a lot of what I talk about with clients and a lot of what I talk about in the Recovery Academy is how can you learn to separate yourself from that eating disorder voice? How do you learn to recognize what is the eating disorder and what is that like shame spiral that it pulls you into? And what is like, how do you, once you recognize it, what are messages that you can lean on, or what are, facts and evidence that can help you recognize that that's not the only way to think, right? That you don't have to only be listening to the eating disorder voice, that you can tune into other channels. And so learning how to do that, because treating an eating disorder is not about eating. That is such a big deal to be able to eat your meals and eat to like sustain and be in your life. It's amazing. an eating disorder is a psychiatric issue, right? So it's not just what we eat or what we don't eat. It's how it's about these emotional issues. It's about these mental messages that we tell ourselves. So treatment is about learning how to recognize those messages and not let those messages control and run your day and your life. And then how are you learning to like care for yourself and show up for yourself when you're dealing with mental health symptoms and when you're dealing with emotions? That's what recovery is. And I teach you that in the Recovery Academy. All right, my friends. I'm looking at the time. Group. We have a group in a few minutes. You can learn more about that at the Recovery Academy. But I'm going to finish my lunch and refresh myself so that I can go to group in a few minutes. I would love for any of you to join us in group. You can learn more about that at recovery-academy.com. It's the silver or the gold membership level, and all that means is you just save on the content and the information that's coming out, and you get support. You get to join our sweet little groups. So check that out. But y'all, I'm gonna go, and I will see you guys, you all, y'all, whatever, on Monday next week. Bye, friends.